Hi, I'm Gina. I'm a nursing student from Harper College. I'm here to perform a head-to-toe assessment on you. I'm going to start by asking you a couple of questions. Can you tell me your full name and birthday?
My name is Patrick Merrill. I was born December 2nd, 1998.
Okay, where are you right now?
Currently in Chicago, Illinois.
What month is it?
It is April.
And why are you here?
I'm here for an assessment test.
Okay, so that's assessing his level of consciousness. I'm going to assess his cognitive function. So I'm just going to say three things. Just repeat them back to me. Dog, cat, bird.
Dog, cat, bird.
Okay, so that's his cognitive function. While he was doing that, I was assessing his speech, which is clear and understandable. I'm assessing his skin color, noting any cyanosis, pallor, jaundice, erythema. And then you can assess his facial symmetry, which is cranial nerve 7. Just making sure it's symmetric. And then I got his height, weight, and body mass index. He's 6'1", weighs 153 pounds, a BMI of 20. His vital signs, I got already. His blood pressure is 120/80, heart rate of 80, pulse 80. Temperature 98.6, SpO2 98. Respiratory rate 16, pain 0. And then we did perform the Snellen eye exam with the Snellen chart. That's assessing cranial nerve 2. His vision is 20/20. Moving to the head, you would inspect the size and shape of the head, and then you would palpate and inspect the scalp and the hair. He does not want me touching his hair, so you would just move the hair and look at the scalp, inspecting for any like bumps, bruises, cuts, tenderness, lesions, bumps. And then you would assess the maxillary sinuses and the frontal sinuses and the tempomandibular joints. Open your mouth. Okay, close it. And then you would just assess for crackles or stiffness. Okay, eyes. So for the eyes, you would inspect the conjunctiva and the sclera. You would assess the 6 cardinal directions of gaze and accommodation, getting cranial nerve 3, 4, 6. So you would just follow the finger to the midline, 6 slays, and then accommodations going in. You follow the finger in, and then you would test pupillary light reflex, shine the light in the eye, watch the pupil constrict. That's cranial nerve 3, 4, 6, and if it was normal, you would document it as per law, pupils equal round reacted to light accommodation. Moving to the nose, you palpate and inspect for any swelling, tenderness, lesions, pain, and then you test the nose, the patency of each nostril. So you plug one nostril, breathe in and out, and do the other one. Okay, so he's breathing okay. Then you would inspect the ears. You would palpate and the external ear, looking for any pain, tenderness, swelling, lesions. And then you check the inside, the auditory canal for wax or anything funky lodged in there. And then you would perform the whisper test, which is assessing cranial nerve 8. So you just whisper on each side, and he repeats the word back.
Pen. Remote.
Okay, so the cranial nerve 8 is intact. Then you do the mouth. So you inspect the lips, the teeth, the tongue, the buccal mucosa underneath the tongue, his uvula, the palates. You would look for any like bumps, tears, sores, bleeding, anything like that. The color, making sure it's wet, and then you would open your mouth, say ah, ah. So you're watching for the rise. Oh, and you assess his tonsils too. And so you're watching for the uvula to rise. That's cranial nerve 9 and 10. And then you stick out your tongue, and that's midline. So that's cranial nerve 12 that you're assessing. Then you would move to the neck. So for the neck, realistically, you would set the bed to 30 to 45 degrees. Back, like that, and he would turn his head to the left, and I would assess the jugular vein for distension, which there shouldn't be, so he would just turn his head and I would look. But he would be pushed back, so I would look. You shouldn't see anything there. Also for the neck, you would assess range of motion, so you can just turn your head and up and down too. Okay, and then could you shrug your shoulders against resistance? Okay, so that's assessing for cranial nerve 11. Can you just do it normally? Okay, and there you go, it's still intact. Then you would assess the glands. You have the parotid, the salivary glands, and the thyroid glands. So you would just check for any tenderness. And then you would check the lymph nodes. You have the pre-auricular, post-auricular, occipital, submental, submandibular, superficial cervical, deep cervical chain, posterior cervical, and subclavicular lymph node. And then you would palpate the carotid pulse one at a time, feeling for rate and rhythm. And then you would listen with the bell of the stethoscope, the carotid pulse for rate and rhythm, getting any abnormality sounds or for bruits. And moving on from the neck, you would, you could check the chest. So you would know respiratory rate, rhythm, and depth. You would inspect the anterior chest to look. The anterior chest to inspect for any use of accessory muscles, and then you would look the same on the posterior side. When you would listen 5 spots on the front, 3 on the right, 2 on the left, 9 on the back. So you use the bell or the diaphragm. So it would be 1, 2, 3, 4, 5. And then this is his left side, so you have the 2 spots that you listen to, and you listen for 1 full breath. You take a deep breath in and out, that's 1 count. And then pretend this is the right side. It would be 1, 2, 3, if that was the right. And then just turn a little bit. And then for the back, you have the 9 spots. You got 1, 2, that's hand 9, 3, 4, 5, 6, 7, 8, 9. So you do that across. You're good with that. And then you can assess the heart. So for the heart, you would listen with the diaphragm. You would listen to the aortic pulse, noting rate and rhythm. So you listen to that for a full minute, and then with the diaphragm, you would listen to the aortic, the pulmonary, mitral, and tricuspid. And then you would do the same thing with the bell. You do aortic, pulmonary, mitral, tricuspid. So you would listen to that, noting S1, S2, any abnormalities like S3 and murmurs. Then you would do the abdomen. You can lay back. So the abdomen, you would inspect for any discoloration or lesions, bruises, and then you get down feet level near his feet and you assess symmetry. And then on the side, I would get down eye level with the stomach and I would check contour. And then I would inspect the umbilical region, noting for any pulsations. And then after doing that, you listen in all 4 quadrants. So you start with the right, 1, 2, 3, 4. You can listen up, and you can listen in each quadrant up to 5 minutes until you hear a sound. So you do that with the diaphragm. And after you listen to all 4 quadrants, you go 2 inches up from the umbilical region, and with the bell, you listen to the aortic artery, and then 1 inch to the left is the renal artery. And when you go back to the aortic artery, you go 1 inch to the right. That's the renal artery as well. So you would listen for that. And then after you listen, you would do light palpation in each quadrant. So all 4 of them, you do light palpation. And then you do deep palpation in all 4 quadrants to feel if any lumps or masses or tenderness on the organs. You can sit back up. So then to assess the upper extremities, you first inspect the skin color and the condition, noting any lesions or discoloration, cuts, scrapes, bruises. Then you would feel the temperature at the back of your hands, assess the radial pulses bilaterally. You check the fingers for the profile sign, noting any clubbing should be less than 160 degrees, 160 degrees. You assess capillary refill to make sure it's less than 3 seconds. And then after that, you would do range of motion of the hands, so go like this, of the arms, and then the shoulders. And then you test the strength of the hand, so squeeze my hand, and strength of the arms, so go like this, and then pull, or yeah, push toward, and then push out. And then for the shoulders, you just put your arms up like that. So there you go. So that's the strength of the arms. And then for the lower extremities, it's the same thing. You inspect the skin for any discoloration or lesions or cuts, bruises. And then you do the skin temperature with the back of your hands again. You palpate the dorsalis pedis pulse down here. The dorsalis pedis pulse. Okay, and then capillary refill. And then you would assess plantar flexion and dorsiflexion, so push up against my hands, and then push down. Okay, and then you would assess preatibial edema, like that. And then you would test range of motion of the ankles, like the feet, so yeah, twirl your feet around, and then pick up the knees, you pick your knee up like this. And then of the hips, if you could just put your leg out. And then the other one. So I could have also had him lay back and lifted his knee and went like this, but that would probably be the better way to do it. So that would be of the hips, and then push out against my hands, go in, and then same thing with your knees. Okay, so that's testing the strength, and then stick one foot out and hold it for 5 seconds. 1, 2, 3, 4, 5. Other one. 1, 2, 3, 4, 5. Okay. Next would be neurological. So for neurological exam, I'll start with the soft touch. So you do the face, the arms, legs, and the feet. You just close your eyes, tell me when you feel it.
Feel it. Yeah.
Okay. And then you do the sharp and dull test. So this is dull, that's sharp. Will you be able to distinguish?
Mm-hmm.
Okay, so it's the same thing as the soft touch. He just closes his eyes and he tells me what he feels.
Sharp. Dull. Dull. Sharp. Dull. Sharp.
Dull. And then after that, you can assess the Babinski reflex. So you stick your foot out and you just go like this. And his toes should not be curling or spreading, and they did not. So that's the Babinski reflex. For cerebellar function of the upper extremities, you do finger to finger like this. Okay, and then touch your finger to your nose, and then touch my finger, and then do it with the other hand real quick. So you do that in multiple directions with each hand. And then for cerebellar function of the lower extremities, take your heel and run it down your shin, and then do the other one. Okay, and then you would assess the normal gait, so if you could just walk normally. And then you can come back, and on your way back, do heel to toe. Okay, and then while he's standing, you would just do the Romberg test. So he stands with his feet together, his eyes shut, and he tries to hold it for 20 seconds without losing his balance. It's been 20 seconds, you can sit down. So that was the Romberg test. And then you have to palpate, or assess the deep tendon reflexes. So if there was a table right here, he'd put his arm on the table, and this would test the bicep reflex. So he would flex his arm, I'd put my hand there where the tendon is, and then with the hammer I would hit it, and no finger curling. And I would do that again with that arm too. And then to test the quadriceps, his feet are dangling, you get the hammer and you go whoop, his leg kicks out, and his leg kicks out. So that would be for that. Let's see. Well, and then it would be the spine. Did I do the jugular gastric? We'll do the spine assessment first. So you stand up, and then you turn your back to the camera. You note the straightness of the spine. Bend forward, touch your toes. You assess the curve of the spine, the convex, and that the spine is still straight if you stand up. And then you would test range of motion of the spine. So, and you have to stabilize your hips. So if you just want to hold on to your hips and just bend forward, not moving your hips, you can come back up, and then maybe side to side. Yeah, let's see. Making sure I have everything. Okay. Alright, and then that would include the head to toe assessment. Please.